Ebola epidemic of 2013. The three countries at the center of the outbreak were Guinea, Liberia and Sierra Leone, all of whom experienced severe shortage of clean water. But the countries rose up to the challenge, and there are lessons to be learned for the rest of the world. I've been speaking to Musa Ansumana Soko, who leads a group called Water, Sanitation and Hygiene Network, or WashNet.
This was a case in point where we used the outbreak as a scenario for evidence-driven engagement, because at a time when it was, particularly water that was a concern, availability of water services across the board, was a very serious concern. So we used those processes to be able to drive home some of our policy influencing agenda, to be able to tell government that, hey, there is this level of investment that needs to be done very urgently. And then we had a lot of critical stakeholders coming on board, like the two water utility companies like the Guma Valley, that is responsible for water supply in Freetown, and the Sierra Leone Water Company that is responsible for water supply at the provincial levels, activating their own levels of engagement as well to also keep the prevention agenda very forward. Like, for example, trucking water to communities that are very far to reach and communities that ordinarily cannot connect to pipe-borne water services.
Let's talk about another practical problem here. So, creating this new source of water would be a place where people would want to congregate, and that could spur the spreading of the virus. So how do you ameliorate that particular situation in practical terms?
In practical terms, what we have seen happening now very eminently is the fact that there are, community water tanks placed. They've been in existence during the Ebola outbreak, and some have been added. So this also decongests the rush level. So we get a lot of people having access, but then not really like the mad rush that used to happen. It brings home the level of messages that we spread across, to be able to ensure that we get very minimal body contact, and then to get people to be able also be very much vigilant and alert about their safety.
And one of the key messages from the WHO to people around the world was to wash your hands thoroughly and often. What advice do you have for people who don't have ready access to water in Africa?
Absolutely, that's very correct. And I very much agree with the WHO recommendation. We have recommended, basically, a lot of people do have hand washing stations in their homes, in their offices, in their communities, but others do not, particularly when they are deprived of water access. So we also have other means like using sanitizers, which is in fact very common in all of the shops now in Sierra Leone, to be able to also serve, as part of, the means of preventing, further outbreaks and infections.
But sanitizers are a bit of a luxury, are they not?
This is the more reason, like I said earlier, that government need to also scale up interventions that is seeking to increase access, and expand services to water supply and sanitation services that people can get.
And that's